Hi, I'm Whitney Espich, the CEO of the MIT Alumni Association, and I hope you enjoy this digital production created for alumni and friends like you.
Good morning, good afternoon, and good evening. My name is Eric Caulfield, class of 01 and 06, master's and PhD in course 6, electrical engineering and computer science, and the second past president of the MIT Alumni Association. I am tremendously excited to welcome you all to today's keynote session, One Community Together in Service. Now, I just want to share that I'm also really excited about this session because it really is the embodiment of what ALC is really about, which is service and community. And because I have a very special upgraded package that I've used to dial into today's session, even though I can't see each one of you individually and physically, I know because of this enhanced system and because you all are the most dedicated volunteers that we have at MIT, I know and I can feel and sense that each of you is very good looking and erudite. So I'm tremendously excited once again to welcome you to today's session. Now, before we get into the main part of it, I have the privilege of introducing someone who really needs no introduction, and that is MIT President Rafael Reif. A true citizen of MIT, Rafael first came to the Institute in 1980 as a faculty member in the Department of Electrical Engineering and Computer Science. And since that time, he's held a number of important leadership positions at the Institute, including serving as provost from 2005 to 2012, at which time he became the 17th president of MIT. Rafael is a truly committed person to basic science and to MIT's signature style of doing research, which is problem-centered. He's also been a tenacious advocate for accelerating innovation and also in tackling the world's most difficult challenges. In fact, in May of last year, under Rafael's leadership, MIT launched Fast Forward, MIT Climate Action Plan for the decade. Addressing the existential threat of climate change is one of the powerful ways that MIT is working in service to making a better world. And so with that, please join with me in welcoming MIT President Rafael Reif.
Thank you, Eric, and thanks to all of you for spending precious weekend hours with us. I'm delighted you have joined us to connect, reconnect, celebrate, and hear what's on the minds of deans and leaders across MIT. We have begun this academic year with great hope and joy, and also, to be honest, some trepidation. Many of our current students have become more used to learning at home than in classrooms and labs. Some staff and faculty colleagues working from home and collaborating on screen have been seeing each other only in 2 dimensions. Others have been at work on a quiet and subdued MIT campus, longing for the return of our bustling, vibrant community. To put it plainly, many of us are reintroducing ourselves to MIT and to each other. I expect many of you are feeling the same way in different aspects of your lives. When it comes to in-person human connection, a lot of us are really out of practice. We're also resuming cherished MIT experiences, reviving many of our traditions and re-engineering others for a changed world. We're seeking new ways to support each other, and we're moving forward despite the limitations imposed by a society in turmoil. In this time of great uncertainty, we look to our alumni volunteers more than ever before. We are inspired by your efforts to bolster the MIT community, and at the same time reach out to help others in dire need of your knowledge and expertise. Of course, because MIT has its own way of doing everything, we have our own way of doing public service. We believe that public service can be and should be as intense, meaningful, and intellectually rigorous as academic work. MIT alumni help convey this philosophy to our students. Serving others is not an activity separate from academic and professional pursuits. It is a vital element of a wise, creative life. This institute-wide commitment not only benefits the individuals and communities we serve, it also generates fresh ideas and new connections. As MIT alumni, your spirit of service unites our community. You represent and advocate for MIT in the world and keep the Institute's unique culture alive. Whether you recently graduated or are preparing to celebrate a milestone reunion, you're a vital point on MIT's continuum of service, connected not only to your peers, but to those who came before and those who will come after. I'm speaking in quite lofty terms about our MIT alumni community, but it is all true. Through meaningful ethical service, our global family of alumni is making the world better at a time when selfless, compassionate action is more essential than ever. So thank you for all you do, all you are, and all you share with the world.
Thank you very much, Rafael. Now, in just a few moments, we're going to join our student panel and invite them to talk to us. They are an amazing group of individuals who not only think about service as a passion. It's not just a passion for them, it's more like a calling, in the same way that it is for many of us here at ALC and around the world. But before we do that, I have the distinct honor and indeed the privilege of making an announcement about something which is truly historic for our community, something which very much is a full expression and a manifestation of what volunteerism and what service means, and that is the creation of the MIT Alumni Better World Service Initiative. Now, what is the Alumni Better World Service Initiative? Well, it's part networking site, workspace, project aggregator, storytelling platform. It'll be supported by the Alumni Association and really will serve as a way to connect alumni who are working to make a better world through their volunteer activities in a number of different areas, which includes everything from climate to sustainability, human health, STEM education, social justice, equity, and a number of other different areas. Now, the association is planning to promote the initiative more broadly in the coming weeks. But because you all are some of our most dedicated volunteers, we wanted to give you a bit of a sneak peek. Now, and in fact, many of you have already been tapped through your volunteer activities and through your communities to help us shape the initiative. And so that has also happened. Now, how do you get involved? There are three main ways that alums can get engaged. The first of which is to create a project. So if there's something about which you're truly passionate that you've either been working on already, or if something that you've been thinking about that you want to reach out to folks in the MIT community or in your networks to get involved, then you can do it through the initiative. The second way that alums can get involved is to join a project. So if you know that you want to get involved in areas which are outside of your MIT volunteer activities, but you don't really have an idea of what that might look like, you can look up the projects that have already been submitted and then join something or join an effort that's underway about which you're really interested. The third way that alums can get involved is to submit a service award nomination. So this coming May at the Better World Weekend, MIT will be honoring one of the members of our community with the MIT Alumni Better World Service Award. And so we know that all of the work that we do as alums really build towards creating a better world together. And what the initiative will allow us to do is to nominate a member of the community who is inspiring others through their deep commitment. So we'll be sharing the URL, or rather we're sharing the URL. And so you can visit the website and find out more information about how to get involved. And we know that because of dedicated and committed volunteers like you, this service initiative truly will go a long way towards creating a better world by acting as a force multiplier for all of the amazing things that are happening and will be happening in our community. And so with that, be on the lookout in the coming weeks in October for more information about the service initiative and ways that you can get involved. So now as we move into the panel part of our session, I am tremendously excited to introduce and to welcome Jill Bassett, who is the Associate Dean and the Director of the Priscilla King Gray Public Service Center, who's going to introduce our student panelists, each one of whom is using their mind, hand, and heart in service of a better world. And so with that, join me in welcoming Jill.
Thank you so very much, Dr. Caulfield, and a big thank you also to President Wright for this generous introduction to public service at MIT. I'm Associate Dean and Director of the Priscilla King Gray Center for Public Service. The PKG Center, as we are known, is MIT's hub for public service. We educate students to collaborate ethically and effectively with community partners to address complex social challenges. We work locally, nationally, and across the globe. Our work is academically aligned, it is rigorous, and it is often fun. It is my supreme pleasure to introduce to you today 3 awesome students who have been working with the PKG Center over the past year. We have Bhav Jain, Amulya Aluru, and Charlene Shah. They have done internships and social innovation programming with us, and they are really here today to showcase what public service looks like at MIT. And with that, I'm going to turn it over to Bhav to give a brief introduction of what he has been up to and who he is, and then we'll move to Amulya and Charlene in that order.
Sure,
Hi,
thank you so
Bhav.
much, Jill. Hi, everyone. I'm Bob, and I'm currently a junior at MIT studying 6-9, so that's electrical engineering and computer science, as well as brain and cognitive sciences. And I was first engaged with the PKG Center through a social impact internship the summer after my freshman year with the Cambridge Health Alliance. And I was also a participant of the Ideas Social Innovation Challenge last year as well, focusing on trying to build an SMS platform to more efficiently triage COVID-19 for lower income populations. And I'm super excited to be here and speak with all of you today.
Thank you, Amulya.
Hello, my name is Amulya. I'm also a junior at MIT, and I'm studying course 6-7. So electrical engineering, computer science, and molecular biology. So I got involved with the PKG, kind of like Bhav, in the summer after my freshman year through the experiential learning opportunities. I worked with, through PKG as collaboration with Brigham and Women's Hospital and COPE, which is community outreach and patient empowerment in the Navajo Nation. And I worked with other MIT students and people on the ground in the Navajo Nation to help implement a technology platform for COVID-19 contact tracing and case management, and working with stakeholders there to make sure that the platform ran smoothly and worked the best for the people using it. I'm excited to talk more about my work today and also hear more about Bob and Charlene's work.
Awesome, thank you. Charlene.
Hello, everyone. My name is Charlene. MIT has been my home since 2013. For my undergrad, my master, and now I'm in my second year of PhD in course 2, which is mechanical engineering department. And with amazing support and community from the PKG Center, I am currently working on sustainable aquaculture. And aquaculture is the cultivation of aquatic organism. And in particular, what I'm focusing on is to grow seaweed. And we're making a sensory device, a monitor device that predict and prevent diseases in seaweed aquaculture in order to reduce livestock losses, promote cost saving, and of course, sustainable food production. And working with local farm in the Northeast Coast and in Maine to develop this technology together.
Incredible. So I'd love to dive a little bit deeper and hear more details about each of the projects that you've done. So Bob, let's go back to you and tell us about both your work with Cambridge Health Alliance and also your work with Ideas in more detail.
Sure, thank you so much. So with respect to the social impact internship with the Cambridge Health Alliance, that was a very interesting opportunity because it largely sprung out of COVID. So after myself and the rest of the freshman class got sent home in March because of the onset of COVID, many of us were searching for internship opportunities. And fortunately enough, the PKG Center had these social impact internships. And at the time, I was extremely interested in anything that may have to do with helping with the COVID response, especially the effect of that response on lower income populations. And so I was fortunate enough to have an offer from the Cambridge Health Alliance, which is one of the leading hospital and healthcare organizations in the Cambridge metro area. And so with the Cambridge Health Alliance, I was basically tasked with trying to help them transition all of their infrastructure onto a virtual setting and also host a series of town hall meetings with people ranging from nurses and physicians and other clinicians, as well as the CEO itself of the organization, and hear from both those key stakeholders and also the patient population in the Cambridge area, and try to understand what are some of the things that we as a Cambridge area community can do in this extreme time of crisis. How can we leverage our backgrounds, experiences, and the challenges associated with COVID to meet the emerging needs of the especially, as I mentioned earlier, the lower income population. So we dealt with issues ranging from food insecurity to COVID testing to ensuring that there were sufficient beds available in the hospital. It was a very multidisciplinary approach to tackling the nation's most kind of imminent healthcare challenge. So that was a fantastic opportunity. And that in some sense served as the inspiration or the springboard for my subsequent opportunity with the PKG Center. So that was the IDEAS Social Innovation Challenge. And so I worked with a team of students actually across the country in April of 2020, focusing on trying to build an SMS-based platform to actually more efficiently triage COVID-19. After speaking with several clinicians, we understood over time that one of the main barriers for people in homeless shelters or in other lower income based settings was actually obtaining initial access to a COVID test and understanding what are the symptoms associated with COVID, especially kind of at the beginning of the pandemic, when information was not as easily accessible, when it was extremely hard, especially for people from non-English speaking backgrounds, to understand how to actually obtain medical care. So we effectively designed a fairly simple SMS workflow whereby anyone living in an unhoused or lower income setting would be able to easily text our SMS line, answer a series of physician guided questions about their symptoms and exposure, and ultimately get sent over to the nearest free COVID testing site. And once they got tested at that COVID testing site, they actually received their testing results back on their SMS. And so it was a completely end-to-end triaging solution, which worked extremely well at the time. Now we're trying to use the support from the PKG Center more broadly to actually expand into other emerging markets, even outside of COVID. So in spaces like TB and malaria, focusing on specifically India and Uganda. So I'm extremely excited to kind of use the experiences I learned back in my freshman and sophomore year and now kind of keep on scaling that up over time with the support of PKG.
Thank you so much, Bob. And that's a really great example about how we try and lure students like you in with some workshops and opportunities and internships, and then give you further opportunity to co-create what you want to do with community organizations and peers to do exceptional work. Amulya, I think this is a great segue to you too, because you were also working with populations relating to COVID-19 and also with healthcare providers. So why don't you give us more detail about the work that you were doing in Navajo Nation?
Yeah, exactly. So similar to Bob, my internship dealt mainly with COVID response. And I started it the summer after my freshman year. So this was in kind of like the initial stages of the pandemic, and my work was in the Navajo Nation. And so COVID-19 exacerbates differences in socioeconomic statuses and essentially makes things a lot harder for people who already face a difficult time getting access to resources and getting access to healthcare centers. And so the pandemic in the Navajo Nation was especially difficult because of the restrictions with guidelines of staying a certain distance apart from other people, capacity restrictions like that. So kind of what we were able to do is kind of work remotely from wherever we were positioned throughout that summer and interact directly with staff in the Navajo Nation who were both immediate contact tracers and registered nurses going out to different homes and different service units and kind of gauging how members of the community were feeling, gauging how their symptoms were, distributing resources about proper COVID quarantining instructions. So working directly with them kind of gave us a perspective to bring back to the technology platform we were working with. So essentially, up until that summer, in the initial months of the pandemic, everything, all case records, all contact tracing records were all done on paper. And so this was a little difficult because the Navajo Nation is made up of different service units that aren't all immediately accessible from each other to each other. And definitely a lot of travel happens in between them as people in the community go around. So kind of what we aimed to do was we worked with COPE, which is the organization I mentioned earlier, in implementing a technology-based platform that allowed registered nurses and contact tracers to use this outline of symptom guides, quarantining measures, and go around to patients and easily access the information they needed to know, such as who the patient has contacted, whether or not they've received a test, whether or not they've received adequate food and resources for their week in quarantine, and so on and so forth. So my role, it went through the summer and I really enjoyed the work I was doing and the people I was working with. And so I kept doing it into the fall of 2020. And essentially I would discuss or speak with case managers and kind of get an idea of how they were using the platform and relay it back to the developers so that they could implement changes based on user feedback. And what I kind of transitioned that into, along with my supervisor, was generating tutorials where we could essentially translate some of the indirect kind of very dense user manuals that the developer provides us and kind of disseminate that in a very systematic fashion to the people on the ground in the Navajo Nation who need it. So for example, we created guides on how to log close contacts. We created guides on how to log a new case. So this way that finding a way to ensure that the people who needed to use the systems can have very easy accessible ways to get the information they need and then go out into their respective service units. So that's kind of a broad overview.
Awesome. Amelia, I think what's incredible about what you described is it's a really great example, a really concrete example of how you, with your MIT specific skills, were able to plug in with community-based organizations that have been working with MIT and working with the PKG Center over time and have had a trusting relationship with us. And for you to be able to go in during a time of crisis and help them with these very technological, translational things and have such an impact. So thank you for sharing your story. And Charlene, next up is you. You're a graduate student. So you came with your own idea of what you were interested in doing. So we'd love to hear a little bit more about that and the team that you formed and your hopes and dreams for what you're exploring and the impact it could have if it really takes off.
Yeah, thank you. I think one thing that always have drove me in my passion, originally as a hobby, is food. Which simply say we all have a particular love for food, and the challenge that are kind of facing us in the future are, first of all, just food security in the future. And also another very important challenge that we're facing is climate change. And sometimes currently that the food security and climate change can be two issues that might be fighting against each other, especially the way in some of the traditional factory farming process. So during my research, what I was looking for is to find a sustainable food production method. And that kind of lead me to aquaculture, and in particularly seaweed. So hear me out. I'm sure you guys have sushi where you have seaweed wrapped around sushi, and it's kind of like almost a slicing, or maybe seaweed salad. And those of you might love it. It's pretty delicious, and it's also very nutritious for you in terms of number of mineral and protein. So seaweed itself is pretty amazing. It's really humble, but it has the potential to feed the world, to fight climate change, and at the same time restore our ocean if done appropriately. There is a rapid growth of seaweed production, especially in the North Sea coast, in Maine, in US. However, because of the climate change and also because of rapid expansion, it's kind of accelerating the spread of infectious disease that kind of can just destroy the entire livestock and entire yield rate, which leads to a lot of socioeconomic instability. So bringing my technical skill or what I learned during my undergrad and master at MIT, which is with ocean engineering, and my own passion for food, with the community support from the PKG Center, linking us with a local farmer here in the state, we're developing a monitoring system that focus on looking at the microbiome, which is our little guy that swims in the ocean along with the seaweed that grow together in order to predict and prevent diseases. The idea is that the microbiome population and diversity are kind of indicators of the health and resiliency of an ecosystem. And by monitoring the little guys, we can accurately and more rapidly detect diseases before it strike the livestock. And therefore we can protect them before devastation occur. And currently we have many students, we have 2 undergrad who are very excited working along with us. We have another microbiologist here at MIT working together where I'm the technical side, but we also in the biological side. It is a project that kind of incorporates a lot of different aspects of engineering, which is a true model of MIT, of community building, working to achieve the same goal.
Wonderful. So Charlene, if you could just also say a sentence or two about how the work that you're doing is like real, like you're in the communities right now, you're doing real work, and what some of the impacts can be if it really takes off economically, climate-wise, food-wise.
Yeah. So over the summer, we're really lucky to actually go down to the farm in Maine. They're actually very interesting. They're always very female dominated. So just a lot of female farmer farming seaweed. And we kind of get an idea in terms of how to deploy our device and how to install, and a lot of user testing in that way. In the big scale thing, so in Asia, seaweed farming is already a very big industry. However, there's potential for seaweed farming to be a big industry in developing countries, such as in Tanzania, in parts of Africa, in parts of India, which can actually create a tremendous change in terms of income for families, especially for the female who are doing majority of the farming. And that could create first of all, a very big social economical impact in the community, in addition to provide an additional income source for the family to provide for themselves. And also, obviously, you're generating food. So that's also solving, in addition, the food security problem that is going to become more and more of an issue in the future.
Thank you. Thank you so much. So before I ask the next question, I just want to take a moment and invite anyone who is in the audience today to submit a question online. We'll have someone who's able to pass those questions on, and as time permits, we'll have the students answer them for you. Or if you have a question for me about the PKG Center, I'm happy to answer that as well. So my next question for the students, and you can answer this in any order you want, or skip if it doesn't resonate with you, is what was most surprising about your experience, or if you're still doing the experience, what's been the biggest surprise about your time with this public service work? Who would like to go first? Looks like you, Bob.
I can start. I think it's a great question. I think it's something I'm constantly thinking about. And I think in terms of the biggest surprise for me, it's been just understanding the sheer difficulty in trying to implement a system that I personally may think has enormous value and can like, for example, decrease cost, increase efficiency, but the sheer difficulty of actually being able to work in the existing fragmented healthcare ecosystem. I think that we face numerous barriers, whether it's privacy of data or whether it's feasibility, cost. And I think in healthcare in general, I've just learned through, both my social impact internship and also then the subsequent Ideas Innovation Challenge that, engaging with the American healthcare system takes a lot of grit. It takes a lot of resources, and it takes it takes people who are able to think in some sense like engineers and engineer around the existing system. So I think like an example of this was, even when speaking with, existing testing sites, we oftentimes had to explain how our patient data would be able to easily integrate into their existing electronic health electronic health records. And oftentimes, because we were operating in an SMS environment, there was no easy way to, for example, automatically import the patient data into Epic, especially since we had an anonymous SMS system in which each patient was assigned a randomized ID. So we never got the patient's name or address or any of the identifiable based information. So we had to explain that although it's not possible to actually integrate directly into your EHR, after you test the patient at the testing site, then you can kind of do a patient intake process and have them be a part of your system. So it was, I think, extremely crucial to really ideate and think of ways to address any challenge that emerged. Whether it's, how exactly do we ensure this is a sustainable system? How do we ensure that we're able to make our system available to people of different, backgrounds, people who may not be literate or able to read English. And like, as an example, we were able to engage with a Boston-based pro bono translator who helped us, make our platform available in more than 15 different languages. So I think that was in some sense, biggest surprise. I almost walked into it thinking that it would be just like any other, assignment or any other class project, but it's much bigger because you have to consider what are the implications even outside of the immediate field, right? What are the implications outside of healthcare specifically? How will it impact patient populations that I'm not directly engaging with? And I think that is a challenge I continue to be in some sense surprised by every day. And I think the experience of actually going through this, especially as an undergraduate student, has been extremely interesting and also rewarding.
Thank you, Bob. Anyone else want to talk about what was surprising, or what? Charlene, it looks like you have something to share.
Yeah, and I think the biggest thing that I found surprising is how much story, how much knowledge the community have to give to students and give to us during the process. And like Bob, you were exactly saying, sometimes when you look at it, when you're originally in the classroom, studying, you kind of look at the problem on the PISA or on the paper, it seems very one-noted. But when you tackle the problem, you realize there's like a lot of different facets. And the next step is that people have been looking at those facets, like just people on the ground, the community people who have been tackled this issue know how to deal with it. They have solution in some way. They also have ideas that they know they want to see. So sometimes in some way, I did a lot of practice is to, instead of like trying to tell my idea first, is to be respectful, be curious about their experience and listen very carefully and like constantly question if I'm making like, am I too in love with my design? But instead of that, I should always be focusing on like, what is it that would be really helpful for them? And that's something that I'm still working on really hard. And I think it's always going to be a challenge, especially if you're in the engineering or design, where you tend to be originally at first being in love with the design. But I think PKG really opened up the idea of when you're trying to make a big impact, you really need a community to working with you.
Thank you. I've just got to pause. I know, Amelia, you have a quick comment. Like, I've already spoken with each of you and you are re-inspiring me. It is just amazing, the incredible on the ground work that you've been doing remotely, for the most part, no less, in partnership in a mutually beneficial manner with community partners, applying your skills and gaining also to create these incredible changes. It's humbling and inspiring. Amelia, what was your surprise?
Yeah, it was kind of very similar to the idea of being in the position. I was in an interesting position where I was both communicating with like the stakeholders, so the users in the Navajo Nation, and then also the developers. So I kind of got to see like both sides of like the story and kind of troubleshooting, seeing how to best represent the user desires, kind of like Charlene was saying, like designing for the community, seeing what they needed the most and kind of like troubleshooting with them in the existing system, and then finding ways to like deliver that to the developers. So kind of like we created like different app prototypes and kind of interfaced with the Navajo Nation community. So mainly the case managers, the people who are reporting directly to us about what the contact tracers were kind of going through. And so we kind of interface with them to kind of go through different iterations of what would be most beneficial to have right now. And I think something also interesting was how different service units have different practices in how they treat or how they go through the COVID-19 contact tracing process, because once the pandemic hit, the service units all had their individual like healthcare units that kind of went and tackled the pandemic response in their own way. And we came in 3 months later into the game, and it was kind of surprising, and also it was interesting to see how different communities already had very strong and very effective practices in place. And our role there was to try to kind of combine the practices across service units, kind of like what I was saying earlier, to make sure that the communication between service units can be facilitated much more easily. And so our role being there, kind of trying to connect the service units, was an interesting one to be in, because we're really just trying to find solutions that would work for every service unit's existing practices. Because in the end, like, we weren't there for like ourselves, like we were there to make their lives easier. And so we would want to implement and tell the developers like what aspect of the system should be changed that would benefit all service units, not just like one and harm the other. So I think it was a lot of communication and trying to like learn how to combine ideas. And I think that surprised me a lot, because kind of like Bob and Charlene like pointed out very well, like definitely very different from classes here, even different experiences here, because we're directly like out of the MIT bubble and like into the community.
Thank you, Amelia. Charlene, we have a question from the audience for you. It's a two-part question. I'll ask the first one first to you, which is, where is the funding originating?
Where is it funny? So I am partially supported by a couple of sources. One is definitely the PKG Center. Thank you. And I'm supported by the MassWork Foundation and also MIT Portugal.
Great. And I'll just add to that in terms of the PKG funding, we raise these dollars, some from alums, some from generous donors, but we do need to raise the dollars, and we very quickly funnel them right back into student projects. Bob, Amelia, and Charlene have received stipends and grants from us directly from this fundraising. Charlene, the second question is, you are a PhD student. How do you match this time-intensive work with your PhD studies? What's your special secret for that?
Well, the special secret, which I think I was being really lucky to have a wonderful advisor, is that a good part of the project I'm working on with PKG actually is a big part of my research. The development of the monitoring system, which is using, we can get a little bit technical because I feel like people will enjoy this. It's a digital holographic microscope. And that development is going to be built into how we monitor the aquaculture microbiome. So that's how my interest and also my research combines.
We have just a few minutes left. I'm going to ask one more sort of lightning round question to the students, which is, tell us quickly how you will use what you've learned through these experiences that you've been having through the PKG Center, either in the classroom as you continue with your academic degree, or after you graduate. What are your thoughts on that?
I'd be happy to start again on this one. So I think for me, I'm really interested in kind of, tackling issues in the healthcare space through an entrepreneurial and social impact lens and framework. And I think, PKG has been extremely instrumental in kind of teaching me the basic principles and groundwork of effectively engaging with communities and understanding kind of what are the ways that I can use my skill sets or engage with other people who have different skill sets from those of my own to tackle different emerging challenges. So obviously, much of my work thus far at MIT has been focused in the COVID space, but arguably we will keep on seeing different types of emerging challenges, even if not a pandemic, in the future. And I think kind of like just the sheer experience of having engaged with so many different, hospital systems and clinicians and insurers, understanding how exactly I can build an innovative and cost-effective solution on my own or with the team to tackle an issue that affects a large, oftentimes neglected segment of the patient population has been extremely interesting. And I think in future such events, whether it's like the next pandemic or whether it's kind of addressing the emerging, like for example, aging crisis, as we have like more and more people aging and not having adequate access to care, for example. It'll be extremely important to use those same guiding principles and think of ways to actually tackle those problems. So in some sense, I view all of the opportunities from PKG as having been ways to learn either ways of addressing specific challenges or more broader narratives and ideas I can apply into other contexts as well.
Thank you, Bob. Amelia?
Yeah. I guess along similar lines, I think this experience taught me more about, I guess, it's very easy to get lost. I think at MIT, if you don't have resources like the PKG that kind of put you in the community and give you like the avenue and the space to connect what we're learning in classes and lab and wherever into plugging that directly into the community and kind of interacting with members and seeing how best my work, everyone's work can best help them. And I think this really taught me that any work can only really be good if it's best serving the people it's meant to serve. So I think I learned a lot of important communication skills that I'm definitely going to bring with me in my future projects, and also thinking about kind of tailoring my future like endeavors, research, like academics, whatever it be, to best serve the communities that need it most and the communities that I guess, yeah.
Thanks, Amelia. And Charlene, last but not least.
Yeah. In terms of the MIT education, we're wonderful in providing a very solid and strong technical foundation. On the other hand, the thing I learned is that in order, like as you guys already said, the importance of community, the importance of people, the importance of like creating a open communicated channel, transparent, to share the decision-making process, to make sure that everybody has a voice and to be respectful and listening to everyone's voice, and how that can truly take a technical innovation and actually change that into a world-changing solution. And that's the thing that I learned, is that the technical innovation we can do, we're trained to do this, but the whole opportunity that PKG provided is a whole other world that allow us to bring it up into world changing.
Fantastic. We just received one more question that I think will be a great closer here for this hopefully incredibly inspiring session. So in what ways can MIT alums get involved or help support the PKG Center to make these types of opportunities available to more students? So there are several ways to get involved. One is certainly on the resource front. If you have resources that can help us provide stipends to get more students in the field, that would be incredibly helpful. If you have leads on organizations that are interested in partnering with the PKG Center because they might be able to use an MIT student to help them achieve their public service goals and their mission, that is another way to be involved. And then some of our programs also have mentorship components or class speaking roles or workshop leading roles. So I encourage you to reach out to me. I believe you have my email address in the chat. It's J, B as in boy, A, S as in Sam, S as in Sam, E, T as in Tom, T as in Tom, at mit.edu, or go to the PKG website, learn more about us and connect with us from there. Thank you, thank you, thank you, Amelia. Thank you, Bob. Thank you, Charlene. And thank you to the ALC for providing us with this opportunity to give you more insight into the work that incredible MIT students do through the PKG Center to make public service a mutually beneficial, rigorous, academically aligned experience as part of the MIT education. So thank you, thank you. And with that, I believe I am turning it back to Dr. Caulfield.
Thank you, Jill, and our amazing student panelists, not only for the important work that you're doing for MIT and in your community, but for inspiring us to continue to aspire even higher in the work that we're doing. And so now we'd invite you to continue to explore these topics in a series of 3 micro talks. Over the next hour, you'll have a chance to dig in even further, and we hope that you'll be even more inspired by the work that your fellow alums are doing and their commitment to service and to making a better world. And so with that, we hope you enjoy the talks and enjoy the rest of ALC. Thank you for joining us.
Thanks for joining us. And for more information on how to connect with the MIT Alumni Association, please visit our website.